Раз.
О, все, раз-два, и у меня заработал. Здравствуйте, дорогие друзья, коллеги. Приветствуем вас на сессии, посвященной дистанционному мониторингу. Мы ее назвали «Персональный медицинский помощник». И я пару слов введу вас в суть дела. Наверное, многих этого и не надо делать, но все равно я это сделаю, пожалуй. Сегодняшняя система здравоохранения наша достигла такого предела возможностей в лечении и ранней диагностике заболеваний. Мы можем уже что-то сделать, что-то больше, но все равно мы там очень много тратим денег.
At a very early stage, and we spend a lot of money on that. It is mainly connected to the fact that the medical services that are rendered to our citizens actually provide for from 10 to 15% of our health. The rest of it is our way of life, our genetics, etc. So this big ship, so to say, which we call the healthcare system, wants to shift its course. So we want to get away from the treatment and to go to the prevention. There is a system of VEB, we all know quite well about it, that we need to live a healthy lifestyle, to do sports, etc. And we have the systems of remote patient monitoring or personal medical assistance. This enables us to give a patient a kind of a device, a gadget, with which a patient can, for example, measure his or her blood pressure as well as the external circumstances and get involved in the treatment process. That's how we can provide for 4P healthcare, when we can first prevent a disease or prognose or forecast how it will develop. So it's kind of an individual approach. We can get some therapy for a particular patient. So that's how we can really work with the prevention and involve the patient in the process. That is the gist of monitoring. And with the support of the government of Russia and under the guidance of the Ministry of Healthcare of Russia, we started to implement the project on personal medical assistance. We've chosen the area of responsibility or the scope. This is not my area of expertise, but the colleagues from the Ministry of Healthcare Russia will elaborate on that. And we want to have a pilot program starting from 2024. That's why we organized this session, and we invited representatives of different industries. We do understand that solely doctors and the Ministry of Healthcare cannot do it on their own. We need to follow a complex approach, stick to a complex approach. We need to invite everybody from software to professionals. And we invited many professionals from this field, such as Oliya Artemova, the Deputy Director of the Department in the Ministry of Healthcare of the Russian Federation, Yuliya Gulenkova, Executive Director from VEB.RF, Anton Kokin, the Head of PMO, United Instrument Manufacturing Corporation. Also, we have Anatoly Mayorov, the head of department at the National Research Center of Endocrinology. We have Kolomenceva, the COO of Dr. РЯДОМ, or a doctor is nearby, and we have Erik Brovko, the founder of Zdoroviy.ru, and we have Anatoly Rogoza, who is running late a little bit, but will join us later, the head of the New Diagnostic Methods Department at the National Medical Research Center of Cardiology. So I'll give the floor to our first speaker. Oliya, could you please just describe the program in a couple of words? Yes, dear colleagues, good day. So last year we initiated an initiative. This is the project on the personal medical assistance. Now it's a federal project, and I'm responsible for the administration. The main goal is to create a centralized platform to transfer and process data from personal medical gadgets and devices. And we want to integrate this platform with the unified digital systems as well as external systems. as well as the systems that provide for the medical decision-making with the systems based on AI. Separately, we will work with non-medical systems. This is just the start, and dear colleagues, we are planning to involve you in the discussion. So the main goal is to provide for the opportunity for the big data processing as well as the Internet of Things and unification of the protocols to process data. This is a new format of federal project implementation. It's more flexible, it's more business-filled. We want to have this long-standing effect for our economy, for the Internet of Things development, as well as for the development of main ideas and the medical decision-making process and the support of AI. So, dear colleagues, I really hope for an interesting discussion today. We will organize a set of sessions with external participation, so you will be able to get ready and prepare. Thanks, and as to the federal projects, I'm ready to give some comments. I have a question. Could you please just describe in a couple of words the main goal of this project? What does the Ministry of Healthcare want to do, and what we are aiming at within the healthcare system? To respond to that, the main idea is to provide for some broader approaches when it comes to remote health tracking. We want to create a centralized platform that I've already mentioned, and we want to elaborate on the approaches of health monitoring. And that's why the Ministry of Healthcare of Russia, jointly with national research centers in Russia, jointly with 7 federal subjects of Russia, will develop these approaches, involve the developers, the designers of these devices, and we need to provide for the integration of all data, starting from the healthcare system to the unified systems of the subjects of Russia, and then we need to transfer it to some platforms for patients. We need to fill it in with data sets. And here, dear colleagues, you'll have an unlimited opportunity to work with these data sets to design your products to support the medical decision-making. So the main goal is to enable remote monitoring of patients with external systems, with non-medical services and systems. Currently, we are working with insurance companies regarding this. We want to focus not only on patients with some chronic diseases, but we want to prevent the development of these diseases, and we want to have and enable the healthy population to motivate our population to do sports, to follow, to be on a proper diet, etc. So we start with the prevention, and then we go to the stage of monitoring a patient with what he or she has in terms of the health. We want to have motivated patients with the support from both doctors and developers. Okay, so what is the final goal? What could be set as a KPI? Well, this kind of a dream that we want to add to the mandatory insurance system. Okay, so up to 2024, by 2024, we need to develop a platform. In 2022, 4,000 patients will be covered with this remote monitoring, health monitoring. Next year, we plan to cover 8,000, and in 2024, we want to cover 26,500 patients. And also, we expect that we will have the models of the patient's coverage. We will have the models of the supply of portable devices to our patients, and some models regarding non-medical services. But I believe that over the course of this 18 months, this project will be added by some new tasks and ambitious challenges. Okay, thank you, Oliya. And now I'd like to give the floor to our next speaker, Yuliya Gulenkova, the Executive Director of VEB.RF. She could comment on that, on the remote monitoring, and also explain why VEB.RF is present here. Okay, dear colleagues, thanks a lot for this introduction. Just a little bit of history. Why comprehensive technological projects? Well, this project is not only about medical assistance, but it also covers the electric transport, logistics corridors and channels, etc. These are the projects that the government focused on last year and still continues to focus on that. We do have some tasks when it comes to the input substitution, but we continue to work on the technological agenda. We want to create an ecosystem for the developers of medical devices, as well as the designers of additional services that could be consolidated around this product and project. Why do we say consolidated project? Because on the one hand, we have a customer who sets the limits. So jointly with you and with our technological partners, startups, the developers of the devices, we try to address the problems that we are facing. What are the tools that we use as of now? So the goal is to create a platform up to or by 2024, but the horizon of the project is up to 2030. So we want to establish trust between a doctor, patient, medical device, and the data that is into this system that will enable the medical professionals to do the decision-making. As of now, we say that in VEB.RF we do have the tool to support the early-stage projects. We have the foundation to support the innovation, and we also have the team responsible for the implementation of the new technologies according to the 555 order. We also have some loans and financing for the established businesses, and we have a set of measures to support the industry that we want to have. If we are lacking some risk financing, such as venture investment, we are considering it. If you have any suggestions here, we are ready to consolidate all this, and jointly with our technological partner, we stand ready to work on the barriers and obstacles that are set to us by the Ministry of Healthcare. Okay, thanks a lot. And now, before we transfer to our technological partners, I'd like to pose the question to the representative of the Healthcare Ministry. Who are the technological partners that should help you with your initiative? The Ministry of Healthcare has signed a contract, an agreement with Rostec company. Rostec should draft or get ready the foundation for this work, and our technological partner is responsible for the creation of this platform. So we've drafted the requirements towards the platform, towards the medical devices and gadgets, and Rostec will implement this project jointly with us, hand in hand. So, dear colleagues, there's also an opportunity to take part in it, to enable the systems of medical decision-making, because this platform will enable us to match the data in the open API.
Okay, in this case, we give the floor to our next speaker. I am among women here. Yes, like a representative of Rostec, thank you very much, Igor, for this invitation. I am here for the first time in this role. I am a manager of the project office, which is responsible for the realization of this project. After these presentations, I can say, yes, we'll do it, and finish my presentation. But since the moment when the coffee machine started to work, humankind went quite far in the Internet of Things, and we already understand that IoT, Internet of Things, it's not only standardized approaches, not only venture topics, but also it's an important part of our life, also medical part. And from the point of view of choice of technological partner, we had an approach that we as Rostech have a lot of possibilities, technological possibilities, which also include IoT, materials, sensors, software, and also, of course, communication. This all should be combined in accordance with the orders of healthcare professionals. But for us, also, the issue of standardization is very important. IoT, when we started to organize it, it lacks standards. Now, at the stage of piloting, we have to create these standards, and they should be the central part of our platform. And so then we'll have technologies which we need. Now, I also look at startups of Skolkovo, and we'll use them, we'll give the production platforms of Rostech, and we should understand how now we should produce personal medical assistant. It's not so simple to organize this production, not so simple to receive registration certificate. This all should be done together. And this platform is just a standard stage, a possibility of union of all colleagues and a creation of new sphere of personal medical assistance. And I think we'll develop further in the same direction. And what about Rostech? Do you plan your how do you plan your perimeter? Do you want to create something else, remote monitoring? Do you have possibilities or some thoughts, ideas in this area? Of course, yes. Technical task which we work at now is now concern more integration models of current devices, but also then we'll develop nosology and some other possibilities, fitness gadgets maybe also, and they will be included into medical service. We don't know where medical science goes. Maybe it will be developing very long, but we want to provide this development also with the help of our technologies. Our program today is limited with the two main nosologies, the measurement of blood pressure and detection of sugar level in blood. Scientific work includes two nosologists, but then we have to expand it. Maybe urology will also occur. I am a urologist. Okay, I will discuss this all in brief. I discussed organization issues. Now we proceeded to technical issues. Let's continue from the medical point of view. Unfortunately, Anatoly Nikolaevich is a little bit late. But we maybe ask endocrinologists because, for example, speaking about Alexander Mayorov, he is a specialist in endocrinology. I think endocrinology is very advanced regarding monitoring. They not only can monitor measurements, but also they can intervene. Colleagues, please expand on this. Good afternoon, ladies and gentlemen. Why diabetes? Blood pressure, it's clear. Yes, there are some accumulated experience already, but diabetes, there are two things. A number of people with diabetes is growing, only registered 5 million in Russia. and in accordance with our center, 10 million of people have real diabetes, not pre-diabetes, not risk factors, but real diabetes. And the second thing, this is the measurement tools on measurement of glucose level. Earlier, people measured level of sugar only once per month. Now it's not like this. And when the first glucometer appeared for the home use, there was a question how doctors could look at this data. If glucometer has it in the memory, should we download it to the computer? So then we had application. Then smartphones. Why should we have this in computers? We can use these smartphones, transfer information from smartphones. And then now we have glucometer, which have fit in Bluetooth model for data transfer. Okay, then the patient can look at this. Can he transfer this to doctors, or it can be made automatically? Now we have applications on smartphone of patients. There are two things: data transfer by healthcare professionals or by relative. And the first, maybe relatives started to do this. For example, parents started to monitor this in real time. For example, it's a norm. Now, in our project, we have such a thing as monitoring remotely by healthcare professionals because we have so many patients. In this case, we need to develop technologies of remote monitoring, but not just to transfer data. It's not difficult, but to process it. In the future, we hope that the program of AI would become so perfect, and physicians won't do a lot. Now we are only at the first stage of processing. Within the framework of the pilot project, it's planned that this platform, where we have this data from glucometer, we have 5 glucometers, can officially transfer data to smartphone of patients. And then the physicians need to process this data. 1,000 figures of glucose. He needs to process this data. And the task of this project is to work here first on the basis of 2 systems transferred to regions, several regions within the pilot project, and then we'll help doctors, will train them how to work with the system. And now, speaking, our moderator asked about the final KPI. I think that in diabetes it's like this. We have such a mindset that diabetes is social illness. Diabetes wants to be free, and that's why we want to work at this, and it will be social, really. In the future, it will lead to a decline cost of the government. There will be decline of complications, and if we good perfect monitoring, for example, continuous monitoring, when under the skin of patients there is a sensor, he put his mobile phone, and then he has all data, and this data goes to his doctor, his GP, and his GP can give recommendations. But unlike blood pressure, here the level of glucose depends not only on medications, but also on behavior of people, what he ate, how he moved, and so on. So he uses doses of insulin every day, the patients themselves to do it, and that's all should go to his physician, to his GP, within the framework of personal assistance. Diabetes is quite complicated, but I hope that we'll adapt to it. We have an extensive international experience, and it shows that the system works. Thank you very much. Our presenter comes up to us, and while he's going to us, while he's approaching to us, I would like to ask you a question. Maybe it's not linked with monitoring, but I know that in the endocrinology there are some other tools. For example, you can have this bolus for insulin. What can you say? Pumps. If you speak about this perfect way of insulin therapy, pump insulin therapy, this is continuous infusion of insulin. Of course, pump can be connected with any system, with internet, and manage a patient. But again, there are a lot of legal moments, and here maybe there will be development in the way of creating of automatic algorithms of feedback. This algorithm will be in smartphone. It will change the delivery of insulin. So this data will be sent to a physician 3 times per month, and there will not be a daily monitoring or physician intervention. It will not be needed. It will be automatic. This automatic function. Anatoly, you are a representative of cardiology, and it's a very important institution. Mr. Бойцов also is the head of this institute. This institute monitors the level of blood pressure. Can you say in a few words, like 2-3 minutes, about your experience and about the need to modify and expand this experience? Colleagues, let's speak about elderly parents, grandmothers, grandfathers. What method of treatment do they have now? They can visit a doctor, a new recipe, or their state of health is getting worse, arterial hypertension. Now, in accordance to the current rule, what should happen? It means that twice per year, if follow all instructions of Ministry of Health, he will be called to a doctor, and then for 6 months he will go and live as he wants. He starts to consume medications, and then he thinks, why should I drink them? In 2-3 months, gradually it goes away, hypertension comes back, and when he comes back to his doctor in 5 months, it's good if he drinks the staples in advance for 1 week. And so after stopping these tablets, medications, he stops to do this. What is the idea of homemade monitoring? So there is only one button, and so patients measure blood pressure. And then you can see a good picture. This device makes this procedure instead of a doctor. The first 2 weeks, morning and evening blood pressure should be measured, and then this data goes to the doctor. Then, if the state is stabilized, twice per week. So a doctor has all information. He can see target blood pressure, and he should not intervene. But if he sees that the threshold target values are digressed, it means that he can have a telephone call, or he can ask this patient about his medications, remote consultation, and once during 6 months, he personally communicates with this patient. Abroad, they use this a lot. Also in our cardio center, this simple procedure allows to state that after such indirect contact, 80% of people are good at fulfilling the prescriptions. And then it also can be corrected. The majority will be within a target level, less appointments. And why did not we do this earlier? 2 years earlier, Canadians published this. Everything is very good on paper, but there should be balance. The balance of interests of insurance companies, IT companies, which provide communication. And it should be convenient for doctors and patients. And now, the Ministry of Health and we have a project. We build up a system which allows us to do in real conditions. What are real conditions behind each GP, there are 700 patients with hypertension. And without the system of clues and system of detection of those who really need to be corrected, this doctor will have impossible task. And here we need add to a smart assistant which will focus only on potentially risky customers. I think in 2 months we'll have first test of the systems. In 3 months in 6 regions of Russia we'll have special centers, and about 7,000 of people will have this type of monitoring. And of course there will be some mistakes. We'll see the economic effect, complications, and the key thing in this project is not a technical problem, but we need to create conditions for GP, but it should be an assistant, a smart assistant, and here we need special algorithms. We need to increase productivity of such doctors. And we need to select patients. Thank you very much, Anatoly. You all agree that from the medical point of view it's important to monitor. Now let's listen to business point of view, which is also occupied with Ministry of Healthcare. We have 2 presenters. This is doctor next to you, Dr. РЯДОМ in Russian company. Good afternoon. I want to continue and speak about the topic which was mentioned earlier. Details are very important, figures are very important, and we understand that this issue is relevant. In the audience, I can see very young, sporty people. You live maybe in the Central Federal District. In our country, as in other countries, we have a serious deficit of medical healthcare professionals. It was mentioned about the load on physicians. You are growing older, and every person 35 plus has already 3 diseases, and older more, and there will be less doctors, and you lack doctors. So it means that any medicine in the future should be maximum technological. It should be maximum it should be everywhere a little bit far from doctors, in particular urology. And there is some other question. In Moscow, you can go to a state outpatient clinic. You can go to the federal medical clinic. You can go to a private medical clinic. But this is Moscow. And do you know that 25% of the population of the Russian Federation lives in villages? And 36 million of people. The federal district. There is no cardiologist people. There are young and old people. These people need help, and also they need to be monitored. And it's fine if this project gives you a possibility to evaluate their state, correct their treatment, irrespective of this, where a person lives in Moscow region, in Yakutia or Kamchatka, or some other, or maybe a faraway village, remote village. Have you ever been to FAPI? What is FAPI? This is a big part of our population. Okay, there are some incoming data, which there are challenges. I don't divide the medical industry for private and state. One challenge is deficit of medical healthcare professionals. The next one is aging of population. Aging of population leads to more patients with chronic diseases. We all want to live longer. And we want our parents and close people to live longer. That's the project personal medical assistant. It can be a project which can give you an opportunity to give a start to such projects. I think that the platform should become unique. It should combine patients, physicians, expertise at the level, at the high level. It should combine producers of medical devices and possibly different information medical systems, and it should allow to the patient to monitor his health. And physicians, in this case, will have good quality data on the basis of which he can make correct diagnosis, to have good, correct communication with patients, who needs emergency, who is being monitored, where maybe what type of monitoring should here be. So distribution of resources should be accurate. And it's so important for us now. It's very complicated and starting now, from diabetes and blood pressure, I can say, why should we start from these diseases? Of course, we could go to bigger spectrum and also involvement of other specialties. Mortality number one is from cardiovascular diseases. You always hear that he was so young, so handsome, but suddenly he died. Why? It's so sudden. Sudden are cardiovascular blood pressure also can be referred to this, and it means not only monitoring of the elderly people, but also monitoring of all group of risks, and men are in group risks more than women. Even if you have a diabetes, 3% of adult people, you can develop also cardiovascular diseases. And that's my explanation of this first thing. How interest is interesting? Why is business interested in this? First of all, business now tries to accelerate its competencies from the point of view of technological solutions. Our company, ДОКТОR РЯДОМ, realizes telemedical solutions. Besides them, we also carry out different models which don't have medical components. What does it mean? It means that we realize those solutions which are very close to AI, and at the level of Department of Ministry of Health of Moscow, it helped in logistics of patients with COVID. Also, logistics in infectious diseases, very loaded industries. Logistics is so important, and it can really save our industry. Okay, I am finishing, of course, I understand. We are short of time. Yes, because we have another one representative of business. Thank you very much. Okay, we got your position. Now let's listen to Erik Brovko, Zdоровье.ru. What is your opinion on this? What about your initiative? Okay, I would like to speak about 3 theses which are important in this project. Within Zdоровье.ru, we launched more than 22 nosologies with coverage of 500,000 patients, diabetes, cancer, asthma, cardiovascular diseases, a very wide spectrum of nosologies. And as you know, all these programs were realized without any devices and physicians. We developed unique services which work without this, but we understood that without integration of physicians and without caring devices, it would not be so effective. All this works in combination, because if a person has a chronic disease, he or she wants to stay healthy. What does it mean to stay healthy? It means that you have to control your disease. These are 4 tasks: to put medications in time, to make appointments with doctors in time, what can have an impact on your diseases, and not to be alone. For example, in our program, we have a very good case where an old woman who is older than 83 years, she is always communicating with our assistants, and she feels more confident. She's not so alone. This is quite important. Personal medical assistant is not only a device. It's important also to have a holistic approach which covers all needs of people, and in this case, he will use it. Secondly, this is market transparency and clear conditions of startup. We are working in the working group, and I'm glad that Ministry of Healthcare combined talented people to create very transparent conditions, because in Germany we also see that the algorithms of reimbursement is quite simple. Startup attract investments. They prove that this startup has therapeutic effect in diabetes. This is hemoglobin control, and then it can compete for its customers. The same will be here in Russia, and there should be all good conditions for all AI, for all participants, the same conditions. And thirdly, as a conclusion, I would like to say that it's not enough to create a system, not enough to build hospitals, factories on production of different devices and create information systems. Everything should be work only in case if we really help a person, because health of people consists of 4 elements: attitude to body, behavior, body, and sense of life. And as a startup, we can't, of course, influence on a sense of life and body. But then, if we combine efforts, we can change people's culture. Because without this, devices and clinics won't work. Let's use holistic approach and change our medical healthcare system together. Thank you very much, Erik. Thank you very much, dear colleagues, friends. We fit our schedule quite accurately. I want to finalize our session. And or to say that when there is a way, when there is the will, there is a way. And I can see that Skolkovo supports us all the time. The guys who organized this session, Julia, Shiglova, Sergey, thank you very much. And now I think that we will reach our goals and also urological patients. Thank you very much.
Сделан из старых забытых вещей, из ночи и дня без обмана, из порванных струн и разбитых идей, из холода и тумана. Ты соткан из дыма и верных друзей, и разных незыблемых истин, из горя и радости света теней. А может, из чьей-нибудь мысли. Ты сделан из старых ненужных вещей, оставленных кем-то на входе. Ты сделан из очень хороших людей, и тебе это очень подходит.
МТС Стартап Хаб. Работа с реальным бизнес-заказчиком МТС. Доступ к ресурсам самого крупного телеком-бренда в России. Не можешь поверить? А в твой стартап обязательно поверят. У нас есть все, что тебе понадобится. Ресурсы, клиенты, технологии, каналы продаж. Мы оценим твой продукт, правильно применим в своем бизнесе и масштабируем на мировой рынок. МТС Стартап Хаб ждет тебя и твоих нереальных бизнес-идей.
ВК-звонки доступны везде и без ограничений. В 4К и с активным шумоподавлением. Будьте всегда на связи в ВК-звонках.
Встречайте приложение ВК-клипы. Удобный видеоредактор. Уникальные маски и эффекты. И стильные фильтры для обработки. Еще быстрее, проще, вертикальнее. Теперь в отдельном приложении ВК-клипы. Место встречи талантов.
Привет! Классно шьешь, варишь, печешь и вообще что-то производишь в Москве? Тогда сейчас самое время поверить в то, что ты делаешь, заявить о себе и занять свое место на рынке, пока другие не заняли. Смотри, это твоя дверь в новый мир. Открывай и узнай, чем мы можем тебе помочь. Москва-24 для бизнеса. Давай с нами.
Журнал «Эксперт» — это российский и международный бизнес, общественно-политические процессы, аналитика и прогнозы, рейтинги и интервью. Специальные условия на подписку на сайте expert.ru. «Эксперт» — настоящий деловой журнал.
Thank you.